All right, let's dive in. Today, we are talking about some of the most powerful, most impactful medications that exist, the ones that work directly on our central nervous system. Now, these are absolute lifesavers, for sure, but they also demand our respect and a real understanding of how they work. We're talking about the drugs that treat things like depression, Parkinson's, and epilepsy, but they're operating on the most complex, most intricate system we know of, the human brain. So that begs a pretty serious question. What happens when these essential medications go wrong? Before we get into those really high-stakes situations, we first need to get to know the major players. So let's do a quick tour of what I like to call the brain's powerful pharmacological toolkit. First up, antidepressants. You've probably heard of different types, like SSRIs and SNRIs, and they're not just for depression. They're often the first line of defense for anxiety and can even help with some chronic pain. Basically, they work by fine-tuning the levels of key chemical messengers in the brain, like serotonin. Then, we have the antipsychotics. These are absolutely foundational for managing conditions like schizophrenia and bipolar disorder. They work on a different system altogether, mainly targeting dopamine pathways to help bring thought and perception back into balance. And to round out our little tour, let's talk about anticonvulsants. The name kind of gives it away. Their main job is to prevent or control seizures. They do this by stabilizing the brain's electrical activity. Think of it like calming down an electrical storm in the brain. A really common one you might have heard of is levetiracetam, which most people know by its brand name, Keppra. I mean, just look at this list. The sheer scope of what these meds treat is, well, it's staggering. We're talking about conditions that affect hundreds of millions of people all over the world. From neurological issues like stroke and Parkinson's to psychiatric conditions like anxiety and depression, these medications are just fundamental to modern healthcare. Okay, so we know the key players, but what about the essential rules of the road for using them safely? Think of these as the universal precautions that pretty much apply across the board, no matter which CNS med we're talking about. Look at this number, 2 to 4 weeks. I really want you to let that sink in for a second. This is one of the most important and honestly most frustrating things to understand, especially with antidepressants. They just don't work overnight. It takes that long for them to build up in your system and start having a real effect. So patience, right at the beginning, is absolutely crucial. This slide breaks down the 4 core principles for safety so well. First, like we just said, be patient. Remember that delayed onset. Second, and this is a big one, don't stop suddenly. Sticking with the plan is key to avoiding some nasty withdrawal effects or even a relapse. Third, watch yourself and report any side effects, even minor ones. And fourth, it's best to avoid alcohol because it can really interfere with the medication and make side effects like drowsiness way worse. Okay, this brings us to the absolute core of why we're here today. We're going to look at 2 very rare but very serious, life-threatening syndromes that can actually be mistaken for one another, and knowing the difference, well, it can literally be a matter of life and death. On one side, you have serotonin syndrome. This is caused by way too much serotonin flooding the system, usually from antidepressant meds. On the other side, you have neuroleptic malignant syndrome, or NMS. This is caused by the opposite problem, a sudden, severe drop in dopamine activity, typically from antipsychotic drugs. So totally different causes, totally different pathways in the brain. So here's the million-dollar question. How can anyone tell them apart? I mean, at first glance, they can look pretty similar. You might see fever, confusion in both, but the biggest clues are right here in this title. One is fast and shaky, and the other is slow and rigid. This table lays it all out perfectly. Just look at the onset. Serotonin syndrome is fast. We're talking hours. NMS is slow. It develops over days, even weeks. But the real smoking gun, the biggest giveaway, is what's happening with the muscles. Serotonin syndrome gives you hyperreflexia, clonus. Think overactive, twitchy, jerky movements. NMS is the total opposite. It causes extreme lead pipe rigidity and hyporeflexia. The muscles just lock up. Let's just hammer this timing point home because it's so important. For serotonin syndrome, the clock starts ticking almost right away. You have a dose change or add a new drug to the mix and bam, within hours, the symptoms can just explode onto the scene. It's a sudden, acute crisis. Now contrast that completely with NMS. This is not a sudden attack. This is a slow, creeping burn. The symptoms sneak in over days, sometimes even weeks, after starting or upping the dose of an antipsychotic. That huge difference in the timeline is a massive clue for doctors. So if you only remember one single thing from our entire time together, please let it be this simple but incredibly powerful mnemonic. It's the key to telling these two apart in a crisis. Serotonin syndrome is shaky and speedy. Neuroleptic malignant syndrome is not moving and slow. And this slide shows you exactly what that mnemonic means in the real world. Shaky and speedy refers to the tremors, the clonus, those involuntary rhythmic muscle twitches, and the super overactive reflexes you see in serotonin syndrome. And not moving and slow, well, that perfectly describes that extreme muscle rigidity, the slowed down movements, and the reduced reflexes you see in NMS. So, how do we wrap all this up? Why is knowing this stuff so important for anyone who isn't a doctor or a nurse? Because the ultimate takeaway here is all about your role on your own healthcare team. See, you're not just a passive recipient of medicine. You are an active partner in your own care. That means tracking your symptoms, especially when a medication changes. It means communicating clearly and reporting everything. Understanding the red flags for serious issues, like the two we just discussed, is part of that partnership. And always remember, just taking the medicine as prescribed is the foundation of both stability and safety. And that leaves us with one last big thought to chew on. In this modern age where we have these incredibly powerful chemical tools to help the brain, is it possible that knowledge, understanding what these drugs do, how to use them safely, and what to watch out for, is actually the most vital prescription of all? Thanks for joining me.